Hello, everyone. My name is Dr. Faraz. I am a cardiologist at Prime Medical Center, Barsha Heights. But today I'll be talking on the topic impact of fasting on heart health, and I'll give you special insights on COVID-19. So first, let's go on, and we will start with the presentation. Okay. So what happens to your body during fasting? Like, let me give you some insights as it is Ramadan, so everybody will be fasting from morning suhoor time till iftar time. So this is a normal physiology that takes place in your body when you're fasting. The changes that occur in the body during fasting depend on the length of the continuous fast. Usually it takes almost more than 8 hours after the last meal to go into that state. So the initially what happens is the body uses the stored glucose and it will break down and use it. And when it's over, then it will metabolize your fat as the next source of energy. So using your body's fat stores as an energy source can help you in the long run and lead to weight loss. And it will also help you control your blood sugar, cholesterol, and blood pressure. Fasting and blood pressure. While in majority cases, fasting helps to lower the blood pressure, and high risk people like smokers, diabetics, and family history of hypertension who has can check with the doctors before starting fasting. And the blood pressure can shoot up in few people, especially in the iftar time when people have sweets and salty foods, especially the fried item. So you have to have a control over that. And how can we control the blood pressure is there are a few strategies that I would like give you knowledge about. Most of you already know it. If you have blood pressure, you should cut down on your salt, and it should be less than 2,300 milligram per day. That is a small teaspoon, you can say. If it is less than 1,500, it is more better. Which things contain the salt more is like processed foods, canned foods, junk foods, fried potato chips, and all these things just to be avoided. I know it is difficult to avoid fried food, but you have to take control over yourself as we don't want it to be shooting high. Fried and oily foods are like you already know what is samosa and puffs and whatever we like having. Even I'm a great fan, but I try to control it. Excessive tea and coffee, as they are CNS stimulant, they stimulate the nervous system, so the blood pressure can go high. So avoid that during the iftar time if possible. So hypertension, blood pressure is a silent killer. So what happens is I will explain you. There are some risk factors for heart disease, stroke, and everything. But what happens is like whenever a person has blood pressure or he's a smoker or he has diabetes, these things cause eruption and disrupt the linings of the arteries, the vessels that supplies the blood everywhere. And on that, an inflammatory process takes place, and on that, the cholesterol comes and accumulates. So slowly, they accumulate, and over the years, if the blockage is there in the heart arteries, you'll get a heart attack. If it's in the brain, you'll get a stroke. If it's in the kidneys, you'll get the problem in the there'll be renal artery stenosis. So this is a long-term thing, and people don't tend to take care of that. So today I'm trying to emphasize on that, and you have to really take care of yourself if you really want to go ahead in the long run. So always check your blood pressure before and after a meal, and see if there are any changes that is happening, especially in the Ramadan time. Fasting can again, lower the blood pressure. So you should also be aware of that. That even if you don't have blood pressure, if you're just a normal person, so fasting can decrease your blood pressure because there is less fluid in the body and you might be dehydrated. Fasting can also cause an electrolyte imbalance. So there are electrolytes which maintains the body physiology and water content. So they might go up and down because of the food contents that you're taking and while you are also fasting, which can lead to different arrhythmias. Arrhythmias are irregular heart rhythms. This can be caused by, increase in potassium levels or decrease in potassium levels or other electrolytes. So I'll talk about certain diets, including low-calorie diet, protein-sparing, modified diet. They also require some supervision, again, because they can cause electrolyte imbalance. If there are fluctuations in blood pressure during Ramadan, please don't forget to see the doctor. There are a few guidelines which I have accumulated and I'll share with you. You're already meeting your doctor. If you have blood pressure, you should reduce your caffeine intake if it's shooting up high. Yeah, but if you are too addicted to coffee or tea, you have it at the suhoor time so that you don't have withdrawal headaches. Use less oil in cooking. You can air fry and bake food and use non-sticky pans. This will help you with the food will be yummy as well, and you can go on with that rather than deep frying the oil, because those are containing trans fats and saturated fats, which is not good for you. And what can you have in the suhoor time? You can have low sugar soluble fiber foods such as oats and things which absorb slowly in your stomach. So this will prevent headaches and complications related to low sugar levels during the daytime. And make sure you drink at least 8 to 10 glasses of water between iftar and suhoor, so you keep yourself hydrated and you don't have your blood pressure more lower. You get adequate sleep, because if you don't sleep at night properly, don't take a proper nap of 8 hours, your blood pressure might be going high. Avoid excess exposure to sun, and this is why, because again you're less of water, and excessive sun can again cause you more dehydration, and you can cause your blood pressure to lower down. You can get light to moderate exercise after iftar and before dinner, because if you're less on energy and sugar levels, you don't want them to be lying down somewhere on the road. So is there some requirement to change the medicine for the blood pressure? Most of the blood pressure patients are having medicine that can be taken once daily, and sometimes people require twice daily. So depending upon what stage you belong to, grade 2 or 3, you can be given a combination therapy or morning and evening therapy. Other things since they are taken at one time or twice, so there's not so much requirement. You can have it at the suhoor time and after iftar directly, so that the dosage can be adjusted, and you can have a check on it and note down the blood pressure readings and see if there are changes coming in. Then the dosage of your blood pressure medicine needs to be adjusted. Okay, so diet plan. This is a very, very well known diet that has been prescribed by so many doctors and advised by especially the cardiologists. We call it DASH, dietary approaches to stop hypertension. It is a flexible and balanced eating plan that helps create a healthy heart, and it is no special food actually. It is just normal food in normal quantity, just avoiding food which one should not eat. So what are these? Eat more vegetables, fruits, whole grains. Include fat-free or low-fat dairy products like yogurt and milk. Okay, you eat more fish, chicken, beans, nuts, vegetable oils, and limit the foods that are usually deep fried and having more saturated fats, fatty meats, and fully fat dairy products. Okay, even tropical oils such as palm oils and all those things should be avoided. Limiting sugar sweetened beverages, there's added sugar in the drinks, sweetened drinks, even colas and sweets which are canned, like you have gulab jamun and rasgulla and all those things which are canned things. So I would recommend not to eat that. So what you have to take care is and know about DASH diet is that it should be low in saturated and trans fats, rich in potassium, calcium, magnesium, fiber, and protein, and they are lower in sodium, so it will help you retain less of water. Cholesterol, yeah, so this is a very important thing. People get the most of the heart attack, stroke because of this main culprit. So we have to take a control over it. Don't think that you're starting a medicine, but yeah, but even lifestyle modifications, walking 35 minutes a day will help you control it. So fasting improves the body's metabolization of sugar and cholesterol. So, and regular fasting can decrease your actual bad cholesterol. You might see a transient rise sometimes, but yeah, again, if you are consistent with it, you will see that it has come back to normalcy. Some because some people are switching from 3 meals to 2 meals in a day, so it will reduce your weight as well and lower your cholesterol levels. No specific requirements for changing your dosages, because as it is taken during the night time before sleeping, so you can have it at night itself. Avoid deep fried items. Diabetes are a very important thing to be taken care of, especially type 1 diabetes people. They may be having, increased sugar levels. We call it hyperglycemia. And because of that, the ketones develop in the body and we can have ketoacidosis. People start feeling short of shortness of breath. They cannot take care of themselves. They are dehydrated and they might need urgent ICU admissions. So you have to be very, very careful with that. You meet the doctor, see, and change your dosages. Sometimes we adjust the dose according to the person body weight, and we try to give a minimum dosage like 1/3 of the dose in the morning, 2/3 in the evening. It depends upon person to person and the doctor's choice as well. So for diabetics, include more slowly absorbed food so you don't feel more hungry, and begin fast with pulses and meals along with fruits and vegetables. Drink plenty of sugar-free and decaffeinated drinks to avoid dehydration, because the most important factor that leads to ketoacidosis is dehydration. So you have to control your sugar and keep yourself hydrated. If you're taking insulin, you might require a little modification as well. Okay. And the type of insulin you're using might also need to be changed. Pre-mixed insulin is not usually recommended, but then again, every person has a different architecture and have a different choice. When you break the fast, you should have small quantities of food, not together. You have everything together during the iftar time. You should go and pray and then come back, then have something else. So that is recommended, because you will develop too much acidity and then too much reflux, and all those things will be coming in. And eating too much salty food will also make your blood pressure go high. So what is next is reach out to your health professional if you have having any symptoms or change, or you're passing more urine or extreme tiredness. One thing to be taken care of: you're taking medicines, please avoid check on your hypoglycemia if your blood sugar levels are going low or anything like that. So if it is going low, you can have glucose tablet, sugary drink, or snack or sandwich at that time. Recommendations to reduce your risk of hypoglycemia: you use fruit and veggies, whole grain fibers, lean meat, fat-free or low-fat skim milk, reduce added sugars, little or no salt. To conclude, we can say that fasting has a positive impact on heart health. If we keep calorie intake low and control salt, walk 35 minutes a day, it will obviously help you control blood pressure and decrease your body weight. Oh, very important topic. So we have done with fasting. Now we are on COVID and heart disease. So let's talk about it. A very important topic many people don't know about. Many people are very curious to know about. It is not about scaring people. It's just making them aware of things that are happening. And don't worry, we have good news in the end. So COVID-19, I'll just give you some insights. Most people already know of what is happening, what is the mechanism, what are we having, but still I would like to explain a little. So it is a virus that has taken all over the world, and it affects the airways, the intestines, the lungs, the brain, everywhere it affects. So how does it attach to your body? It acts on the ACE2 receptors, which are present almost everywhere, and it can cause symptoms accordingly where it has affected it. Some people may be asymptomatic rather than have a day fever or nothing and just a little weakness, and they'll just come back to normalcy. Some people may progress to have severe symptoms, and they might require the proper treatment. Some symptoms that they get, so symptoms may be varying for person to person, and depending upon the comorbidities that you're having. So most common symptoms are fever, dry cough, tiredness, etc. Less common are aches, pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, rash on skin, difficulties breathing, chest pain, loss of speech or movement, and some stroke, heart attacks. All those things have been going on as well, but not necessarily everybody will have it. So the main complications that come: acute respiratory failure, like you'll not be able to breathe, you'll have pneumonia, your liver can be get damaged, you can have kidney injury, you can have clotting all over your body, you have muscle breakdown, chronic fatigue, and some heart complications which are related to COVID are myocarditis. It is just like an inflammation and viral infection of the heart muscle. What happens is in this, if person has gets a severe problem, then they might lead into heart failure, and the heart muscle can be damaged, and they will have a series of symptoms: retention of water, heart, even they will be having shortness of breath, and like your heart pumping will go to like a very lower level, like less than 30% of ejection fraction. Because of this, then people can also develop arrhythmias, irregular heart rhythm, leading to sudden cardiac arrest. And this arrhythmias can also cause formation of clots, and which can lead to stroke. Mitral regurgitation: whenever there is an impact on physical or emotional stress on the body, because of the pressure, there might be a reverse flow in the heart valves, which we call as mitral regurgitation if it is happening near the mitral valve, which can again lead to shortness of breath and atypical chest pain. Deep vein thrombosis, as everybody knows, it's a coagulative condition. So some people might develop clots in their veins, and which can sometimes mobilize to your lungs, arteries, and veins, and cause pulmonary thromboembolism or stroke. Some people have been showing that they have got a rise in blood pressure. So this is a different thing. So I would like to say that with scientific advancement and research, early diagnosis and treatment has decreased death ratios and showed good benefits. And now the vaccines have also come out, and they have showed in preventing serious complications from COVID-19. So post-COVID measures, what to be done? Get yourself evaluated, see your body parameters, how are they doing, take a professional consultation. If you had a lung infection, some chest physiotherapies are advised. Do breathing exercise, like blowing with a straw in a glass of water, blowing up a balloon, lying flat or in a prone position, like on your flat on your tummy for some time, and breathing in. It opens up the dead airways. Take proper rest. Okay. This is very important. You are dehydrated, your body is going through some stress, so it will take some time to recover. So give yourself time to come back to pre-COVID body strength. I know it will take some time, it will be hard on you. Other things is some people will have some chest discomfort and heaviness. So it can be because of the bronchitis or lung infection as well. So you take steam inhalation. Okay, do take all the medicines, but also try taking this after that, so that it like 10 times you heat the water, put a towel on your head, and try breathing in. So it will help you or thin the mucus and take out all the bad things from out. If you have any kind of chest pain, shortness of breath, or exertion, tell your doctor, get proper advice. We don't know what is there, but obviously physical examination gives us a better view about that. There might be a raise in blood pressure after COVID, but may not be necessarily a post-COVID complication. It may just be a transient rise. So, but yeah, you should not neglect it. Have a record of your blood pressure noted down, and tell your doctor, and he might be doing further testing to know whether you're actually having blood pressure from before, or it is a new thing that has come up for you, and then he might advise you treatment accordingly. So in the end, I would say stay safe, maintain social distancing, wear face masks, get vaccinated, and protect others, especially the elderly, the weak, and those with low immunity. So we will win over the COVID, inshallah, and thank you for your attention. Now we can go ahead with the question answer sessions, and let's see. I'll try to answer as many questions as possible. Okay, so I have got a question like advice for the patient with underlying heart disease, how COVID-19 can damage heart, your recommendation post-COVID recovery. Yes, so some people might get mitral regurgitations because of the pressure that they have been going through, and which can lead to arrhythmias and chest pain and all those things. So what I would recommend is you have to come to see a doctor and evaluate yourself. If it's a mild range, it's a moderate range, or it's a severe range. Sometimes if it's a mitral valve, a tear, it can cause severe shortness of breath, and then other treatments are required. So you keep yourself hydrated. There are some medicines that can be given based on the condition that you're having. So not necessarily all COVID patients will require medicines for that. Okay, I hope I answered for that question. And let me see the other questions that have been asking. Okay, one patient has asked me whether he had a heart surgery and should he be continuing taking Plavix for his life for how long? So the answer is like, yeah, once you have a heart surgery, it is recommended to continue 2 antiplatelets for 1 year, and then make it 1 antiplatelet, whether it's aspirin or whether it's clopidogrel or whether it's ticagrelor or anybody. It has to be continued for lifetime. Usually recommended is aspirin, but some people might not be able to take it. So clopidogrel is advised for lifetime, so you don't have any future events. It tries to prevent that. The other one has also asked me whether I can, whether they can go for water fasting. Okay, so water fasting for days, it's not actually recommended. It helps you detox, get your body detox, but then again, it will have more effects on like causing more arrhythmias or heart problems or dehydrations and electrolyte imbalance. Because you might lose weight, but it's not necessarily the fat that you're losing. You're losing the muscle mass, you're losing the carbs, the essential things of your body as well. You might get dehydrated, you might become hypertensive, you might also become what do you say, hypoglycemic. So proper care needs to be taken, and I would not recommend. I would rather recommend other diets. Like DASH diet is good if you want to lose weight. Intermittent fasting sometimes is so good, but again, that might cause some gastric problems in some people. And this one person has also asked me, is a cardiac evaluation must in post-COVID patients? So is again, this is a different thing, because it's not just COVID evaluation. COVID is affecting everywhere, everywhere in the body. So what we have to do is, like, you get yourself checked up and let us know, or let us see what parameters are going wrong, whether your sugar levels are going up high, whether you're having some murmurs, whether you're having a little more congestion, having bronchitis. Then accordingly you will have to be treated for that. Just not just cardiac evaluation. Sometimes, because it's a coagulative condition, it might get clots anywhere in the body. We never know whether the heart arteries are getting affected as well. That can be done by a stress test. If the patient has recovered, we can ask him to do that. But then again, furthermore, researches are required. It is not a statement, I would say. We have been asked any specific complications for blood pressure patients post-COVID. Yes, the blood pressure, it's a stress level. People cannot get sleep, so the blood pressure might be rising in people who are having COVID. So, but then again, it can be a transient rise. We have seen patients who have been having blood pressure for a month or so, and by a constant changing diet, and after the COVID everything is over, we have seen that they have come back to normalcy as well. But then again, we have done the further important testing to rule out whether it was actual hypertension or not. And as you know, hypertension is a silent killer, so I would not recommend it to go unnoticed. What's recommended, LDL or calculated LDL? So we have been asked. So LDL, see, it's 0 to 100, but we as a professional, we start medicine after 160 milligram per deciliter, and this is the actual recommended dose, and most of us prefer that, because this is a threshold mark. That means something is going on. And if you're too young and you're having this kind of cholesterol level that is too high, then obviously there's something wrong with the the receptors, which is metabolizing the cholesterol. So proper care needs to be taken, and proper evaluation needs to be done. It's not necessary nowadays that only old people will get a heart attack. People who are people who are having other issues, like even just a smoker, even young people. We have seen cases where 19-year-old guy gets a heart attack. So now we have other risk factors, others coming in. Diabetes, smoking, like blood pressure, all these things are risk factors, so need to be proper taken care of. So one person has asked me whether hyperglycemia related to COVID-19. Yes. So one thing is that many people are given steroids, especially in COVID-19, to prevent the attack. The inflammatory markers go high over there. So for that reason, can also sometimes cause increase in your sugar levels. So proper dosage adjustment needs to be done with the steroids especially, and it's a combination of treatment that is given. So proper evaluation and day-to-day dosage adjustment might be required for active patients. So any other questions have been asked? Inflammatory conditions may cause hyperglycemia. Yes, it can cause hyperglycemia as well. Because it's a metabolic condition. Okay, people who are obese are having metabolic, problems. So their BMI is usually low, and they develop more cholesterol, and their sugar levels may not be metabolized. So these all things needs to be taken care of as well. So what precautions should a high BP patient take during fasting? Okay, so for a high blood pressure patient, they have to keep their blood pressure in check, especially before and after meals, and like avoid food that is more having more salt. Avoid salt as much as possible, but not totally neglected, because sodium is also an important nutrient of the body. And fasting usually lowers the blood pressure, but in some people it can increase, especially during the iftar time, because people take coffee, people take fatty food, people take oily food, people also don't walk well, they don't exercise well. They should at least do 35 minutes of walking per day, that is recommended, or 2 hours in a week. So all these things needs to be taken care of. I hope I have answered all the questions. There might be many more coming in, but I think we are running short of time. So I'll take your leave. I hope I have answered many of those. If you have anything, you can email it to me at drfaraz at primehealth.ae, or you can call on 047070999. Thank you so much. Thank you. I hope you enjoyed the session.